This podcast is for informational and educational purposes only and is not to be considered medical advice for any particular patient. Clinicians must rely on their own informed clinical judgments when making recommendations for their patients. Patients in need of medical advice should consult their personal healthcare provider. Hi everyone, I'm John Williams, Professor of Pediatrics and Chief of the Division of Pediatric Infectious Diseases here at the Children's Hospital of Pittsburgh.
And I'm Stephanie Dewar, Vice Chair of Clinical Affairs and Program Director of the Pediatric Residency Training Program. And welcome to That's Pediatrics from UPMC Children's Hospital of Pittsburgh.
What is That's Pediatrics, you might wonder? We want to talk to clinicians and basic scientists and clinical researchers here at the Children's Hospital of Pittsburgh to learn about the advancing frontiers of pediatric and adolescent medicine, to learn about some of the amazing discoveries emerging from our hospital, and to learn about new developments in the field of pediatrics. We'll be releasing episodes of That's Pediatrics every 2 weeks. The UPMC Children's Hospital of Pittsburgh is already a national and global leader in pediatric medicine and research, but some of the things that you may be familiar with that have come out of UPMC and Children's Hospital are the Salk polio vaccine and Mr. Yuck poison stickers, both developed here in Pittsburgh. Children's Hospital of Pittsburgh is also home to the nation's first pediatric transplant center.
We're primarily gearing this series of podcasts towards clinical professionals, researchers, and scientists, but we invite anyone who's interested in these topics to tune in and subscribe. Each episode is going to cover a new topic, such as infectious disease, pediatric emergency medicine, pediatric transplant, cutting-edge research, and a variety of other topics.
Our goal is to bring you information about advances in many different areas of pediatric medicine and pediatric care. As such, we'll be interviewing a variety of different experts, including pediatric subspecialists, pediatric surgeons, basic researchers, clinical researchers, people in administration and leadership, anyone we think has an interesting story to tell you about things that are going on in pediatric research and things that are happening here at the UPMC Children's Hospital.
As I shared earlier, I'm Stephanie Dewar, and I am an Associate Professor of Pediatrics here at UPMC Children's Hospital. I serve as Vice Chair of Clinical Affairs, so oversee a variety of direct patient care activities here, and also am Program Director from the Pediatric Residency Training Program. Clinically, I function as a hospitalist, and so am very involved in the day-to-day operations of the care of patients and interactions with families here at Children's.
And as I said, I'm John Williams, Professor of Pediatric Infectious Diseases. I'm both a pediatric infectious disease subspecialist clinical doctor, so I take care of children in the hospital and in the clinic with severe, rare, or unusual infections. I'd have to say, over the last 20 plus years of my career, in some ways my job's gotten a lot easier. Due to advances in new vaccines and new treatments and prevention for infection, we see a lot less meningitis than we used to see. We see a lot less pediatric HIV and AIDS than we used to see. We have a flu vaccine that's very effective at reducing severe influenza. But unfortunately, there are still plenty of infections that children get, and infections remain a leading cause of disease and death in kids in the U.S. and worldwide. I'm also a researcher, and my laboratory studies respiratory viruses, especially human metapneumovirus, which is one of the leading causes of pneumonia in infants, children, and older adults. And we try to understand how the virus makes you sick and how your immune system can protect you from the virus. And our hopes are eventually to develop treatments and vaccines for this infection. And as Chief of the Division of Infectious Disease, I have the privilege to work with a group of really terrific clinical doctors and researchers who are doing all kinds of cool things in the area of pediatric transplant and lung disease and viral disease and TB. So that's Steph and I. There are 2 other hosts that you'll hear on That's Pediatrics, Dr. Carolyn Coyne and Dr. Brian Martin. Throughout the series, you'll hear them hosting some episodes, and you'll hear more about their own background and their own stories.
We look forward to learning about the latest discoveries of pediatric medicine along with you. Thanks again for tuning into That's Pediatrics from UPMC Children's Hospital in Pittsburgh.